Occupational therapists are trained to help people of all ages function to their fullest by helping them to regain skills needed for everyday activities. I'm Lauren Aldi, and this is your Herald Health Minute brought to you by the Cape Regional Health System. April is Occupational Therapy Awareness Month, so we spoke with Keith White, a Master's of Science prepared occupational therapist with the Cape Regional Health System, to learn more about this specialty.
OTs help people of all ages resume or maintain optimal participation in all aspects of life, including work, leisure, self-care, social activities, mobility, and caring for self and for others. One of the interesting things about occupational therapy is that we don't only address physical injuries or illness, we also address psychosocial injuries as well. So anything that disrupts function. You can apply the principles and basically have employment anywhere there's been a disruption in function. So in a hospital setting, it's easy to address physical dysfunction, but we can also work in anywhere from schools for helping positioning with children. We can work in prison systems, in rehab centers in terms of getting patients to understand function and then how to apply life skills to be able to perform at optimal levels in those roles, whether that is a 45-year-old dock worker or if that's a 2-year-old who's just learning to sit and crawl and position themselves. We look for inconsistencies and then try to address those inconsistencies to optimize their role. So whatever your role is, we try to get you back to functioning at optimal performance. Typically, people assume, because of the title occupational therapist, that we're mainly focused on job performance or job reentry, when honestly that has very little to do with what we actually do. The term occupation comes from using occupation therapeutically. In other words, it's our job to find out what a patient's interests are and then incorporate that into their rehab process so that it's meaningful to them. One of the great things about our work with concussion over the last few years is that once we're able to educate a client on understanding the injury of concussion and what to expect in terms of the healing process, it's been night and day to be able to see a patient move from an area of confusion or not understanding what's going on with their healing process, and just after a session of two of explaining what happens with the brain when it's healing and what to expect in the way of symptoms and recovery. Our position here, occupational therapy in the hospital, consists of two main parts: the inpatient acute care setting and then our outpatient services. In the inpatient setting, it's our job to go and understand a patient's number one, their home setting, their family setting, their former functional ability or their level of independence prior to injury. And then we need to understand their injury and then kind of get a picture of what they're going home to, and then be able to predict what problems might arise or be an issue in terms of them returning to full function. So our goal is always, in both settings, inpatients, outpatients, is functional independence, is to have a patient as independent as possible. So where it differs a little bit in the outpatient setting is, as you said, we get patients coming in with all sorts of diagnoses, both physical and cognitive, that will come in with a disruption in function, and it's our job as outpatients to then create a program that will allow that patient to also return to function in whatever their role is in life. One of the reasons I chose occupational therapy as a profession is because it's a holistic, whole person, big picture approach to healthcare rather than a segmented, compartmentalized approach. So we get the opportunity to really connect with patients and to kind of understand who they are, what their interests are, and what makes them click, and then use that as a therapeutic tool.
For more Herald Health and Wellness reports, visit the CapeMayCountyHerald.com and click the Lifestyle tab. This health video has been brought to you by the Cape Regional Health System. For more information on services and for a healthier life, call 609-463-CAPE.